Dr. Jere here with Mills Chiropractic and Wellness Center. And this week, I want to dive into the hip a little bit and talk about hip dysfunction and treating the hip. However, before I get into today's topic, I think I need to take a step back because a lot of times when patients come in, they've been either told that they have a hip problem or that they believe that they have a hip problem. And so one of the things I want to differentiate today is the difference between back pain, SI pain, and hip pain. Low back pain, is very common. It's the most common reason that people see a doctor in the world, actually. And so a lot of times, most commonly, when a patient comes in, it is a low back problem. However, there are some times where we get SI joint problems. The SI joint is the intersection between the sacrum, which is kind of our tailbone, and the ilium, and that area can get irritated. There's not a whole lot of movement there, but a lot of times when we have dysfunction elsewhere, the body will compensate and twist the pelvis and cause SI irritation. And then we have the hip, and the hip pain typically causes pain that is usually more towards the front of the body as opposed to the back of the body, which is typically where we see SI pain or low back pain. And so unfortunately, a lot of times what will happen is the hip will degenerate. We beat our hips up like crazy. And so as we age, it's common to see degeneration occurring in our hips. And oftentimes what I see in my office is that a patient will get an x-ray somewhere because they say they have hip pain, and unfortunately maybe the training medically isn't as great sometimes, and especially if we're just kind of quickly passed off, they'll order an x-ray and they'll see degeneration of the hip, and oftentimes it's pointed to and said, oh, here's the problem, you have hip degeneration, that's what's causing your pain, that's why you're having all this low back pain. And so sometimes that can be the case. However, a lot of times it gets blamed for problems that's not really a hip problem, okay? Now, the other thing we need to understand about the hip is that the hip is very mobile. And so it allows a lot of movement, and so that we can move and we can walk and things. Hip pain typically occurs when we are walking, or if we have our foot planted and we kind of rotate our pelvis and we feel a pain in there, that's typically hip pain. Low back pain is typically more when we bend, or especially our sacrum when we bend backwards. That's a lot of times when we get the pain with it, or going from sitting to standing. Now, the reason that there's a whole lot of overlap here is because most of the time, most of our patients spend a lot of time sitting, and there's a muscle on the front part of our body called the psoas muscle, which connects both from the low back, crosses the SI joint, and then inserts into the hip, okay? So it really hits all three of these big areas. And one of the big problems we see with patients is because they sit so much, that muscle shortens up. And so as they go to stand or they go to walk, that muscle is pulling. Well, it's loading the lumbar spine, it's loading the SI joint, and it's torquing the hip, right? And so we end up with these very complicated movement patterns. And so something's going to break down, right? It's either going to be the low back, it's going to be the SI joint, or it's going to be the hip. Now, the cool thing is when we treat it, or we treat a patient, we're actually kind of looking at all three things. So whether it's a hip problem, a low back problem, or an SI joint problem, when we work with a patient, we kind of fix all three because all three of them feed each other. And a lot of times you can't get one to work correctly unless you have the other one working correctly, right? You got to fix the whole issue. And a lot of times this is one of the mistakes we see in practice a lot, is a patient will start to feel better and they think everything's fixed when they really had three problems going on, and all you did was eliminate the pain on the first problem because they were overloading, compensating for a bad back or something like that, right? And so anyway, I know I kind of got off on a tangent, and I really just wanted to talk about the hip and the biomechanics of the hip and treating the hip, but unfortunately, a lot of times when we are working with the hip, in order to fix the hip, we have to fix the low back, or we have to fix the pelvis. Sometimes we have to fix the hip in order to fix the low back. So it's just all kind of intertwined, right? And so as it turns out, you can't really talk about one without talking about all three. The summary version is, if you have low back problems or you have a hip problem, get it checked out by somebody that can do a movement assessment, see where your faults are in your movement, and then get adjusted if necessary. get moving. That's one of the big things. We've talked about stretching previously. Getting up from your chair periodically is so darn important. And one of the reasons it's so darn important is it stretches that psoas out. So it's not just sitting there shortened up all day long. And then as we go to move, it stays in that shortened position and just loads everything, waiting for an injury to occur. Drink plenty of water, stay hydrated, reduce inflammation. These are all big things, especially when we're talking about the hip and degeneration, right? There's just so many things that we can do to stay active. Maybe we need to do some supplementation. Sometimes we need to reduce the inflammation in our body so that we can protect these guys, because they do take a beating and they do get worn down and they do create problems. But there's a lot of things we can do to be proactive, right? So anyway, I hope you got something from it. Until next time, stay healthy, stay well.